Welcome to Modernizing Healthcare Fundraising Without Compromising Trust. Quite a mouthful to really say, what hospital foundations need to get right about data security, digital fundraising. Particularly excited about this webinar because we have some really great experts. So I'll turn it over for introductions. First up, John, will you introduce yourself?
Good morning, everybody. John Lord, I'm the Director of Annual Giving at Children's Wisconsin. I oversee all of our broad-based fundraising, including digital. I've been with the organization for about 4.5 years, and I'm thrilled to be here.
Hello, Paul St. Onge here, CEO, co-founder, Doing Good Digital. I've been working with hospital foundations and doing digital fundraising for the last 10 years or so, based out of the LA area. And yes, very excited to be here on this presentation today.
Tiffany.
Hi, I'm Tiffany Ramsey. I'm head of compliance and risk at Engaging Networks. I've been with the company for about 2.5 years. I have an extensive background in HIPAA and healthcare IT, having worked for companies such as IBM Watson Health, and other data healthcare companies. So I'm excited to be here today and looking forward to it.
Great. And I already introduced myself. I'm a Director of Business Development here at Engage Networks and work with a lot of our healthcare and healthcare foundation organizations as they are kind of evaluating technology where a lot of these questions come up. Awesome. So today's agenda, we're going to talk initially about the shift. It may be a shift that you are feeling at your organization, about kind of a shift in security and that taking prominence, particularly as you're evaluating technology. Going beyond the checkbox, I'm going to turn it over to Tiffany. We're really lucky to have her and her expertise, and talk a little bit about third-party HIPAA validation versus self-attestation. Go a little bit deeper into privacy and personalization. We have a great case study from John and his team at Children's Wisconsin. And then we'll do a live Q&A. So it was put in the chat, but just a reminder, use the Q&A feature, and we'll make sure that there's a lot of time for questions at the end. So on this, I was particularly excited about this panel because we have a really diverse set of experiences. Tiffany, with your security and compliance background, Paul, whose team has helped implement a lot of our clients and healthcare clients, and then John, who's like on the ground doing the work at Children's Wisconsin, who came on board to Engaging Networks about 2 years ago and has really evaluated this as part of their work. So opening it up to the panel, how have you seen other organizations shift in their security evaluation kind of as part of the tech stack, or is data governance really being a part of that conversation and that strategy?
Yeah, I can jump in first. I think just for us, and as you mentioned, Carly, we do a lot of Engaging Networks implementations. I think for us, it's all about building trust with other stakeholders across the organization. And the more trust we can build, so if that's with the IT department or your compliance department, and I feel like it's like trust points. We need all these little trust points to add up. And when we have enough trust points with all these different stakeholders, we can start to do more innovation. We can look at maybe when it comes to shifting the data strategy and the segmentation strategy for the patients that are coming over into the digital fundraising program. There could be more openness to that because we've built that trust. When it comes to maybe bringing in AI products or trying AI as part of the digital fundraising program, having those trust points, I think, can help there. So I think for us, it's all about all of these little things, and HIPAA is not a little thing. But I think this is just another sort of point that we can gain. And I think so the more compliant we can be with everything we do, it's super helpful. So yeah, we're really happy about this. And I think it does allow us to just be a little bit more innovative with our clients.
Yeah, and I'm sorry. I'll just throw in there too. I totally agree with Paul on that. And thinking about internally being, in a health system, with lots of internal partners in different areas of the system that we have to work through. On the front end, the security setup is so important, but knowing that we're working with a software platform and vendor partners, where ongoing security is really a concern and a roadmap item for them, that anytime we do want to evolve the work or throw in something new, it makes navigating all of those internal channels that much easier because we do have like a really solid base that we're building from with the tools we're using.
Thanks, John. I know you have some specific examples, I think, for later of like ways that you are innovating and growing at Children's Wisconsin that kind of fall back on some of these. Tiffany, do you have anything you want to add before we move into your super highlighted section, which is the exciting, spoiler alert, Engaging Networks now being HIPAA compliant?
No, I mean, I think I'll cover it in my section, but I do concur, and I feel that on our end, in terms of our clients definitely having more scrutiny around their partners, us being a partner. So yeah.
Yeah. All right. The next slide. So yeah, this is where I really am going to toss it fully over to Tiffany as our kind of internal expert. And so Tiffany had asked, earlier, we did announce that we are HIPAA compliant, and would love for you to tell us like a little bit more of the background, the story there, why we did this, why we chose to do it the way we chose to do it, what implications that means, what our considerations were, and what implications that means for our clients.
Great, yeah. So I'll start off by saying, first of all, HIPAA is a law, and there are big fines for HIPAA noncompliance. The Department of Health and Human Services monthly lists on their website a wall of shame for any of the covered entities or healthcare organizations who have experienced a breach of unsecured HIPAA protected health information. So as a business partner, we don't want our healthcare clients to be on that list, right? Because of something that we failed to do as a business associate. And also, patients deserve to know that the hospitals are keeping their private information private as well. So, that's a key driver of number one, why is HIPAA important? It's a law. And when we talk about HIPAA, there's that special term called protected health information, or PHI. And it's protected because number one, it's coming from a healthcare provider, and it's related to treatment, present, past, or future of patients, or the provision of their insurance. So now, when we talk about that, though, there is a gray area in HIPAA compliance as it relates to fundraising. And so I'll speak to that. So yes, as a business associate, we are obligated to sign a business associate agreement with our healthcare partners. That's a contract that stipulates how we're going to comply with HIPAA, and we're going to keep the data secure. However, these agreements and our contracts also stipulate that our clients really should only use our platform to process the minimum necessary patient data that's required to accomplish legitimate and necessary fundraising tasks. So, I want to set the scene for that we're using this data for fundraising. So in looking at what's on the screen here, there are different types now of attestations when it comes to HIPAA. Companies can either self-attest or they can do third-party compliance. And, when self-attestation is literally somebody grading their own homework. There's no one looking over your shoulder to validate your answers. Whereas a third-party attestation is an audit that provides that validation. So hence on the slide here, validation matters. And we opted to do it the other way. And surprisingly, some of our biggest competitors have chosen to do self-attestation to grade their own homework. But we went through the rigor of a third-party audit. And what that looks like is, it's a big deal. Third-party audits are time-consuming. And before we even went down that path, we consulted with a HIPAA attorney. We consulted with the Association of Healthcare Philanthropy, and made the decision that, yes, we're going to do this. And the review itself is strenuous. It's time-consuming. Our auditors are looking at our internal policies and procedures, diagrams, hundreds of pieces of evidence. So it's a big deal, and it can take quite a bit of time. They're interviewing subject matter experts and our leadership. So that just paints a picture of what this HIPAA compliance looks like, and why self-attestation is really no longer enough. And then, lastly, why we chose this is another key factor here is that this differentiates us, as I said, from our competitors. I mean, we can hang up our flag, and we were proud to hang up our flag to say that we are HIPAA compliant and not just grading our own homework. So I'll pause here. And Carly, do you have any other questions for me on that?
No, I think that was a great overview. And I think, for a long time, right, we were like, hey, we don't keep any PHI. So we don't need to. But we heard more and more from clients and prospective clients of, hey, this is really important to us to protect us as kind of that last little bullet there, like getting into kind of the gray area. So would thank you, Tiffany, for the background. I'm glad that you led that project and not me, right? It was a really strenuous thing that we were happy to do. Would love to go to the next slide and kind of turn over to Paul as we were talking about kind of that gray area. Obviously, like it's important that we maintain HIPAA compliance, but also as we get into that gray area of fundraising and PHI, Paul, I know that your team as one of the main like implementers of engaging networks for healthcare clients and like ongoing consultants really deep in that work with clients. I'm curious like how you kind of approach this.
Yeah, for sure. And yeah, Tiffany, so happy with everything you just said. I think also just personally as a business owner, I am all about reducing risk. And so again, any extra risk that we can mitigate, it makes me very happy as a business owner. It's something that we take very seriously here at Doing Good Digital. But even with HIPAA compliance, I think we still want to be extra precautious when we're working with a hospital or a healthcare organization. So we always want to start with leaning into segmentation, personalization, identifiers that are not PHI, that are not health related. And I think I know a platform like Engage Networks, we're able to personalize all of our data through clicks, through content people are clicking on, through surveys. And so we really encourage all of our clients to build your own identifiers, build your own segmentation through collecting data from your constituents. And specifically why we're very happy with the HIPAA compliance here with Engage Networks is we have a big part of our strategy is gathering surveys from clients, having free fields where people can either send a message to a doctor or a nurse or what have you. We actually had one client, they had a survey they set up in a different platform. And they didn't even realize they had not looked at the survey results for 8 or 9 years. And by the time they looked at it, they realized like, oh my God, there's a ton of PHI data that was here, and nobody even knew about it. And that platform wasn't a HIPAA compliant platform. So I think with in this situation, I mean, yes, we have a process in place. We're constantly reviewing active surveys that are out there. But I think in any sort of case where, or even a current campaign where someone is adding in PHI even by accident, at least we know we're safe. And I think, John, I know one campaign that you're working on right now, a World Cancer Day campaign, it does involve a survey component. So we can at least be confident if someone does add any PHI, even though we have the disclaimers, we can be confident that it's inside of a HIPAA compliant platform. And then lastly, and I mentioned this earlier on in the presentation today, but just around building trust. I think if we can build trust through this, it allows us to take additional risk. And especially when it comes to, I mean, we're always trying to push the limits. We have a lot of AI services and offerings that we're bringing to the market right now. And so by building trust through a HIPAA compliant platform, through HIPAA compliant processes, then it allows the IT department and other stakeholders to be a lot more open. Oh, one thing I also wanted to mention, I don't know if this rings true for anyone, but we had one client a long time ago where they had a feed of data coming from the hospital side into the digital fundraising platform. But they said to me, they were like, our IT department doesn't even remember this. And they were so concerned about making any change to the strategy or to the data criteria that we were recommending because they didn't want it to wake up anyone on the compliance side. Again, this is a long time ago. But I think now that won't happen, because I think if we're confident that data is going into HIPAA compliant places and we're being secure, we can have that confidence in making those requests to the IT department. So yeah, I'll pass it back to you, Carly.
Yeah, I feel like I hear often from clients, particularly when they're moving on to us because of the segmentation, because of the surveys, they're really starting to think holistically about like digital grateful patient or digital grateful family programs, how to better leverage the data they're collecting either through our engagement tools coming in online or through other places in the hospital or healthcare network. And how to make sure they are doing that appropriately, but knowing that there's kind of the safeguard in place, I think is probably why we are seeing more and more healthcare organizations say that this is a mandatory and not a nice to have, even if they don't really intend to truly bring PHI data on.
Yeah, it was good.
That
Just I'm gonna jump back in, because I think most of our clients were not, or all of our healthcare clients were not bringing in. It is a gray area of what is PHI, because certainly they are patients when we're setting up some sort of digital grateful patient program, but we're not bringing in those additional, PHI information and data points. As Tiffany mentioned, we want to bring in a minimum amount of data, but clients that are pushing the envelope, they are segmenting the data that we're bringing in. So even though we're not storing PHI, some of the segments that we're getting from Epic or from the wealth screening platform might be segmented by service line. So we can tailor the communication just a little bit more personalized. And again, this is a gray area. But it is, at least if we know it's gray, at least we know it's going into a HIPAA compliant platform, so that if anything were to happen, or I guess nothing would happen because it is HIPAA compliant platform. So yeah.
Yeah, nice kind of like bumper lanes there, I think.
Exactly.
So it's a combination of us being compliant and also folks having the right business rules in place as they're trying to innovate and develop in this direction. I would love to turn it over to John. I know that there were a lot of considerations on your end when you were like doing the platform selection process. I know your team is doing a lot to innovate on the fundraising, some of which might kind of cross over into this data. So I'm curious, how you and your team are thinking about this.
Yeah, I think when our search started, security was definitely a component in what we were looking for. But we were really focusing on functionality. We had confidence in that, like our Razor's Edge database, the info that we would be bringing over was going to be okay. But that was kind of as we were thinking about getting off the ground and an apples to apples usage of the software and things like that. So as we think about like road mapping and how we're going to be building things, we have a relatively new Grateful Families program that's up and running. We're looking at doing other things with SMS. And as Paul was talking about those gray areas in terms of fundraising data, this kind of over time, as we've been working on our internal roadmaps, now that we're kind of up and running in the software, looking at things, all of these security concerns do pop up, especially in terms of the Grateful Families, so that as we get that program up and running, that we are building the strongest confidence possible with the information that we're using to reach out to those folks. So kind of to the overall kind of journey that we've been on for this. So a few years ago, before I even joined the team at Children's, it was decided that we really needed to move to a new platform from kind of a hodgepodge that we've been using historically, where different departments or different areas within the foundation were using different software platforms. There was really no uniform training within the foundation or anything, and we were a little overly dependent on vendor partners to make things work for what we were doing at the time. So when we started the search, we really kind of focused on kind of this apples to apples, who was going to be using things in the long term. So we focused on things like email support, which would be used pretty broadly in my work with annual giving, our events team, our stewardship team, and just our general foundation communications. And then even with gift support, even at the basic level, with my body of work for annual giving, we wanted to make sure that we had something that was going to be able to be robust as we wanted to evolve that. But as conversations go, we think about the new work that is involved with that, and being able to personalize like giving strings on donation forms, things like that, that really weren't even in a possibility before, suddenly have come up as like conversation points, and what can we move forward, and like how does our Grateful Family program benefit from this, and what we can do. And at that point too, some of that is external lists that we're going to be bringing in and managing, and trying to make sure that even though those are coming in and those are screened first, that we are keeping everything as safe as possible, since some of that information isn't directly tied back. And we also are looking at like bringing in our other events work over time. We want to expand into SMS giving and better support with our sustaining donors. And all of this is really going to tie back to a bidirectional flow between whatever platform we were using, and the tools that our operations team uses for getting all the information back and forth, which is currently Omatic and Razor's Edge. So those were all considerations that we were looking at, to really kind of as a base level for getting things in, and kind of where we were growing from that. But we also needed to make sure, because of the kind of usage of both internal and external partners with this, that we had something that was not only secure, but easy to use for a variety of skill levels in staying secure in that way. So, we could set rights and restrictions and things across the board for internal and external partners. And then all of this bundled up together, as I mentioned earlier, Children's has a really strong and stringent IS security process and protocols that everything had to run through. So that was like all of the teeny tiny, just few items that we had to take into account as we were looking for the platform. And so we eventually landed on thinking about where we were, thinking about where we wanted to go. Engaging Networks seemed to be the best fit. And as we've roadmapped things out and heard about like the roadmap here, things line up even better. And the security components of this are really great, because it's an extra level of security and peace of mind that we have, because I think like most organizations, everyone's running as fast as they can all the time to make everything happen, not only with current work, but planning the future work. So like for when we deal with those gray areas, things like, email names, some giving history, things like that, and possibly like with the occasional external list for bringing in some extra communication points, it's really helpful that not only is security top of mind for our organization, but knowing that we are working with software platform partners like Engaging Networks, where it is a top concern and a ongoing roadmap issue, and with like our digital strategy partners and Doing Good Digital, that they are staying like not only on top of, but ahead of security protocols and trends in the sector, because it's just something that could easily fall off the radar with different people managing and working within the software. So it's really great that we can have that peace of mind and actually really focus on the work that we are doing and want to do, and moving forward with all of that. And kind of where we are now with everything, we started with that apples to apples, getting everything up and going. So with our annual giving, working the comms, we are using the email and form functionality. Our comms team is reaching out to our email lists. And now we're looking at both with the work that we've been doing for the past year or so that we've been really live, gathering information that we can use for secure segmentation as we move forward with those, so that we're making sure that our inbox placements are the best that they can be, and that all of that information is really aligned internally and externally, and still building out those protocols, and looking at now how we can take that and move into the bidirectional flow, so we can actually set up something a little less manual when we are building and communicating those lists. We really want to move into the SMS portion of things like by the end of this year. And so I feel very confident about the baseline work that we have to do that with the security functions that are within the software. And then also really just getting a supporter hub up and running, so that there is information there, but as people are logging in to look at their sustaining gifts, other things like that, that they're doing it in a way that they can feel secure and we can feel secure as we continue moving forward. Just a couple things.
Yeah, it's been really exciting. Just a few things. You're just doing a couple of things. No, it's really exciting to see you all grow into that and do more. I know Paul mentioned the World Cancer Day survey, which I believe was yesterday, and being able to do kind of more of that proactive, digital engagement and gathering more information about supporters and their interests and what they care about and what drives them to give to Children's Wisconsin. But then additionally, I'll do a little preview for you, like really excited about your second annual Giving Day coming up next month. I don't remember the exact dates, March
31st.
March 31st. Okay, I want to make sure I got it right. So I think, I don't know if there's anything kind of related to that as you all were launching that you want to go into, but I know that some of the stuff that you mentioned SMS, some of the like exciting things coming up next in which you are kind of continuing to innovate and kind of balance all the information you are receiving and collecting either directly from supporters or elsewhere with kind of how you are using that to fundraise and drive your programs.
Yeah, I think with Day of Giving, one of the, not to downplay security as we're talking about so much, but I think one of the most exciting things about that last year and moving into this year was just much more robust design options for our donation forms, and just like the digital wallet options that we have available now that we didn't before. The fact that we can build donation forms that are campaign specific, that really feel more like landing pages that we can provide information for. We can, our Day of Giving, we generally have a toolkit that we have on that landing page for folks so they can go out and help spread the news for the day. And all of that lives in a secure world so they can get everything, share the information, and feel confident with what they're doing to help promote and fundraise for children's. So, all of this is like the security part is an underlying part of this, but it's really the robust functionality of the software and what it's allowing us to do. But to focus on that and to focus on the evolution of design, segmentation, the modularity of things, and just know that at a base level that we're doing everything from a secure place.
I see Tiffany smiling there, probably wanting to say PCI level 1 compliant. That is right. Like the underlying piece of all that fundraising and the Giving Day, I think, is that compliance is knowing that we have a relationship so you can reach out to us if you all need anything on that front.
Yeah, I want to actually comment on that too, if I could. And thank you, John, for your comments. Thank you for appreciating our efforts. I heard you say, that our posture, our security posture has given you a level of assurance. And so I want to piggyback on that to say that, here at Engaging Networks, we are very serious about security and data privacy. And I would invite our guests online to go visit our Trust Center. We also recently posted a blog about nonprofit cybersecurity and compliance that kind of talks about our journey over the 6 years, the last 6 years, basically. But one other thing I want to point out is that even within our contracts, our standard contract, we are contractually obligated to do these annual attestations or audits right now for SOC 2 and for PCI compliance. So the move to go to HIPAA compliance as a external third-party attestation was really a no-brainer because, again, there's so much overlap between what we were already doing. So, we're big on security and compliance here at Engaging Networks, and I thank you for recognizing that. And no, security is not glamorous, but it needs to be there.
It's like, but Tiffany is. No, if we want to go on to the next slide, I think, wanting folks to have something to take away of, good questions for security partners. Again, kind of piggyback on what Tiffany said about, is this validated or just self attestation? What are the encryption standards? So, I think John mentioned a couple of things really, and then data's here and moving, and Paul talking about kind of all the ways data is coming in and out of the system, maybe going into your CRM, maybe coming in from another source. Asking about scalability. I think John really spoke to, okay, what we were doing 2-3 years ago when we were beginning this evaluation because of some of the added features, ease of design, other things, and just because kind of the innovation of his team of like, okay, spending less time doing that and more team innovating on like doing a new Giving Day and iterating off that and trying new things. Is it going to be able to scale with you? And then asking kind of about that regulatory readiness. I think Tiffany can speak to it. Doesn't stay the same. That is a continually evolving piece. So I'd love like feedback from the three of you on kind of any of these questions or kind of additional context.
Yeah, I was just gonna jump in and say that I think now that Engage Networks is HIPAA compliant. I mean, this is probably obvious, but I still think it means we all still need to maintain a level of due diligence and care when we're running any type of campaign. Because we could set up a survey in Engaging Networks that asks doctors or excuse me, patients or donors for a whole bunch of PHI. So I think it's really, that's where I think someone like us come in, or your digital partner comes in, to make sure that we're still running campaigns in a very compliant way. So that means if you are asking for information in a campaign, having disclaimers, and really discouraging people from giving you certain types of information. For a couple of clients, we actually have an automated, we have some jQuery we've added to the form that will detect certain words that are put into the form so that the form won't submit. So I think just having that, again, if some of that information ends up in Engage Networks, we're okay. But I think just still maintaining a level of due diligence for anyone working in the platform or on campaigns is very important.
Yeah, I like to think it's like we put in bumper lanes, but you still have to, roll the ball the right way. If you throw it out, it's still kind of, it sounds like a combination of both, like those pieces in place and also kind of ongoing internal business rules and guidance from a team like yours. John, Tiffany, anything you all want to add here? Or does this kind of cover it?
I think that kind of covers it. The other thing that kind of popped in my head as Paul was going through things and just the conversation overall is, as we talk about kind of the gray areas of fundraising and what fields and what information that is, and then realizing that this stuff does change over time. There are new things that'll pop up as a gray area, or maybe a gray area will shift in one way or the other. So just again, like internally and externally, just having a team of people that are keeping an eye on this is really nice, just to keep in the back of our minds as we're planning on things, because we can plan, but then we're allowed to pivot as we learn what's going on, or if it feels like there's a change that could be happening, how do we mitigate that in the short term, or what do we do to pivot until we know more about that and what we can do. So again, it's just being able to keep an eye on all of this and to look at what's gray, what's black and white, and how we continue to navigate that with the different kind of work we want to do moving forward.
Yeah, the piece that I would add to that too is definitely the due diligence part. I mean, as Paul said, I mean that's important, that we all do our due diligence, and for hospitals, healthcare organizations, it's important that you all work collectively across the board, IT, compliance, and legal, to make sure that the things that you're doing are in compliance with, for example, with HIPAA, and with consent, patient consent, where that's necessary. So your legal and your compliance folks will know all that. And then the fourth bullet on this page talks about just the ever-changing landscape of compliance, regulatory compliance. Right now, there has been some push to change HIPAA, the HIPAA security rule, for example, which hadn't changed in decades. And so now there's more scrutiny around that, which could be coming in the future. It's already been posted, but more around cybersecurity controls, which again, we're already doing that because of where we are today as a platform. So via our PCI and SOC 2, we're already handling that, but it's never ending. The controls are changing. And why? Because the bad actors are always out there looking for how they can take advantage of things. So due diligence, understanding what is allowable, definitely key.
I was going to jump in with one more point too, and I think when I think of what is success, and I think especially in today's world with AI and efficiency and how quickly things are changing in the digital world, like, I mean, everyone always says healthcare is 5 years behind or whatever it may be. But I'm like, if we can do these things, if we can get our data in order, if we can get compliant in all of these processes, then I don't want to be 5 years behind. I want to be pushing the limits. I want to be doing more personalization. I want to be leveraging AI for segmentation and automation and even content. And so I think by doing these things, it creates a nice foundation that we can hopefully start to push that innovation.
Yeah, I think that's a nice segue into our questions. We've got a couple. If you have not submitted a question QA and you have a question, please drop it in. You mentioned AI, Paul. I'm curious if there's anything you want to expand on there. I know a lot of folks I talk to, it's like we don't know what we want to do with AI, but we may want to do something. So I'm kind of curious if there's anything you're able to expand on there that a lot of like your clients are considering or considerations you're considering with a lot of the clients you speak to who are thinking about, hey, we're maybe getting pushed or feel
Mm.
like a little bit of pressure of like, are we being left behind? Are we 5 years behind? We don't want to be more behind. But really balancing things with balancing that innovation with caution and compliance.
Yeah, I think two things. I mean, for us, we're seeing AI on the content creation side. So I think that's maybe less to do with HIPAA and data, but certainly it's allowing us and our clients to do more robust campaigns, more animation in campaigns, more segments because we have more capacity all of a sudden. But on the data side, we recently, I guess this is a bit of a plug, but we recently launched this thing called AI automated journeys, where essentially we partner with an AI platform that will connect to Razor's Edge, Salesforce, engaging networks, and it can really identify segments in real time, that we could either be reaching out to on a one-on-one basis or pre-scheduled and pre-written automated donor journeys go out to those segments. Um, that platform we're working with is also HIPAA compliant. It's called Dataro. Um, for this to even get traction, we are in the midst of launching it with one healthcare organization right now. But for this to even get traction, we need to know that all of the platforms that we're working with are taking privacy and are taking PHI seriously. And I don't think we'd even be able to get traction on that conversation if that wasn't the case. So yeah, that's why we're excited.
Yeah, and then Tiffany, I know on our end when we have like AI innovations that we're considering at Engaging Networks, it's very opt-in. There are a lot of considerations on our end. I don't know if there's anything to put you on the spot a little bit that you want to speak to there.
Yeah, I mean, AI is definitely
That's a whole different webinar.
no, it's definitely a big subject. And, again, the due diligence is important. And Paul said it correctly. Before you even get started, you need to make sure that those partners, those vendors are handling data properly, that they're properly being vetted. So, I can say that our clients vet us. We vet our third-party vendors that we use, and AI is appearing in everything. So that's a whole nother area that now you have to look at. What are they doing with our data? Where's that data being stored? So a lot of ramifications. But to the question about biggest misconceptions about data governance in healthcare, having worked with healthcare IT organizations before, I know that the desire to work with AI is there. That healthcare organizations are wanting to partner with companies that are using AI in innovations. For example, to do things with medical health care records, to use AI to do diagnostics or to look for cures for cancer. I mean, so the desire is there. I'm sure John, having and working with Children's Hospital, that there's things that's happening in the background there, where AI is popping its head up, but that requires data governance, across the board. So all these innovations, I think there's a balance. How can healthcare organizations balance innovation with compliance? Due diligence is the word that I'll keep harping on. Due diligence in vetting your third-party vendors. Um, oh,
Yeah, I'm gonna change your internal title, Tiffany Due Diligence Ramsey. Um, no, I think that's really that's really helpful, Tiffany. Thank you, because I think it's an open question for a lot of folks. And then John, I'm curious for you, your team is, I think, really, really innovative. And so I've talked to a lot of hospital foundations that are like, we're almost there. We're really like, we feel we've kind of got everything where we want to be. And now we really want to focus on modernizing our digital fundraising. So I'm curious, like, for your kind of thoughts or advice you would have on like for hospital foundations or healthcare foundations that are really feel like, okay, we're in a place where we're really focused now on modernizing our digital fundraising, kind of where you would suggest they like focus and prioritize their energy?
Yeah, I think, and I mentioned this a little bit, but I think where we started and what seems to be working for us is, as you think about the growth and evolution when you're working like in a new platform, when you're looking at these new things, it's starting from an apples to apples place. And like, what are you doing? How are you going to recreate that in a new platform or with the new programs that you're building out, and then looking at the tools available to you, and starting your own like roadmap program by program, but then just really it's all about communications with internally, identifying the strategic partners that you're going to have to figure out who is handling what live, what bits of information live in what area of your department, your system, between your internal and your external vendors. It's starting small and then just kind of not overly slowly, but really just kind of laying out how you can incrementally add. Like, I don't think we're ever going to be ripping the band-aid off of anything and just going whole hog into something and just jumping into like whole new modularities or, like new usages. But finding the way that we can grow incrementally in a way that makes sense in a secure way with buy-in for folks. So again, it's mostly it's conversations and communications with all the key stakeholders and laying it out that way. But what again just seems to be the best is starting with where you are and then figuring out how to make the most meaningful small changes that will build up over time and take you to the next level.
Yeah, I was going to jump in with just and building those relationships. I mean, I think it's socializing everything you're doing with those key stakeholders, so they are aware that you want to push the envelope, but at the same time, really showing them along the way how compliant you are, whether it's through the tools you're selecting, the vendors you're selecting, or the processes that you have in place for each campaign.
Yeah, and I think and that makes me think of like what Paul was talking about before, just in terms of like healthcare being 5 years behind, that kind of idea. It's, healthcare systems are so big, and there is so many people that have to look at it, improve and run through like approvals for everything with legal and security and IS. That all of that takes time, and that's one of the things like where sometimes a smaller nonprofit in a different sector, something might be a little bit more nimble. But as platform security like this is established and shared, it allows that 5 year to become 4 year, 3 year, two. It allows you to move on a little bit quicker because you already have this baseline communications of knowing where you're starting from and not having to revet or revisit a lot of security issues.
Thank you so much, Tiffany, Paul, and John, for jumping in and giving like your unique perspectives. I think for folks on the call, if this is interesting to you, if you're thinking about a new platform or, we're here, there's a QR code there. We'll send some follow-up information, including this recording after. So if you're thinking about a new technology partner or even a new partner in Paul's team at Doing Good Digital, that's really helping kind of align the data and governance and, come up with some of these business rules while still really pushing you to innovate. We'd be happy to talk to you individually. We'd be happy to talk to you as a team who've helped move a lot of great clients like John's team at Children's Wisconsin onto Engage Networks. We're really excited. Please check out their giving day on March 31st. It's a really great
QR code for that.
Yeah, we need to.
Yeah.
We'll probably send it. We're gonna send out some follow-up materials. Would love to have a conversation with you if these are things that you're considering. Just want to say thank you so much to the team here. Thanks to everyone for listening along, and hope to hear from you. Hope you have a great day.
Thanks, everyone.
Thank you.